And Sherwin joins us from New York now. So Sherwin, the market's looking a little bit better in South Africa as well. The rand recovering after many days of just absolute turmoil. But on the ground, just give us a sense of the fear perhaps spreading across the United States.
The market's very much, I think, Francis, reacting to what they are now hearing from the federal government in terms of the expansion of testing. You'll know that the United States is one of the only developed countries that has lagged in terms of the spread of its ability to test nationally. The Trump administration now outsourcing various testing kits to companies, from private companies that can provide these. We understand one of them is a Swiss company, and also putting out to tender the ability for private companies to develop tests that can speed up the process of diagnosis. There is a current coronavirus test that takes 3.5 hours. They want this to be down to an hour, and they've given two companies $1 million each to develop a very quick diagnostic test. But very much correctly pointing out the streets of New York City, where we are based, the commute to work, taking what is normally a congested subway system, a congested bus system. If it's raining, you see a sea of umbrellas on the sidewalks, empty as we came into the office today. Essentially, people heeding calls from certainly the city, and certainly from various companies, that people start telecommuting where possible, which means working from home to avoid the levels of congestion and the confined spaces where the coronavirus, known as COVID-19, can spread easily. Even at the United Nations, Francis, we understand that management here at the United Nations in the Secretariat is currently discussing what they're calling phase 3 of their COVID response. Essentially, shutting down the building, shutting down operations at their headquarters in New York, and allowing essentially all people to work from home, except for critical staff like security. Let's listen to what Stefan Dujarric, the Secretary General spokesperson, had to say on this very issue a short time ago.
The direction we're going into is to reduce as much as possible the footprint of people going into this building. That anyone who can work from home will be told to work from home. What is important and to remember is that the UN's work will continue. We will continue to support peacekeeping operations. We'll continue to support our humanitarian operations. Our colleagues will continue to work on the budget. Things will be done from home. If member states decide, like the Security Council, decide that they need to hold meetings, we will support them in whatever way we can. Obviously, and I think they understand, with reduced services. But they will have to be critical meetings of the Security Council to renew mandates, critical meetings of the Budget Committee to approve budgets. We will support those. They may be not with the number of interpreters that we like to have, but the work of the UN will continue.
And this issue really being brought home by various sporting federations, Francis, the National Basketball Association, the NBA, following suit from their decision to cancel or suspend their season, the National Hockey League, the PGA, the Major League Baseball, Major League Soccer, college basketball, ATP tennis, and the list goes on. This is really going to, hit home to a lot of people when they aren't able to turn on their television sets this weekend and see their favorite sport.
Yeah. And tell us a bit more about the lag in testing. Sherwin, I've seen a lot of blame sort of being going US President Donald Trump's way because of an initial lack of response that's, according to some, has it become very political?
It has become political because, remember, we are in an election year. You saw the front-running candidates on the Democratic ticket, Bernie Sanders and Joe Biden, both take to national television yesterday to give what they deemed would be their response were they to be president of the United States, and had access to the tools that are provided to the incumbent in the White House. There's a real sense here, political or not, that this president and his administration did not act as speedily as was required in terms of getting tests to the states, to the hotspots. You remember the clusters that were discovered first in Washington state, and then in California, and then in New York. States essentially that welcome foreign visitors, that are conduits and entry points for people flying into the United States. And so now you have seen the Food and Drug Administration approve more tests. You see the administration now coming to terms with being able to get these testing kits out to various states. They say they should be up to speed by some point next next week. And remember, we're a few months into this crisis now, and only by next week the United States is now saying that they will have these tests. And this is why we are going to hear from the President himself later today, Francis. He will be declaring a national emergency. But this is coming off the back of various municipalities, cities like New York City, various states, some 30 plus, declaring national emergencies. So the weight of those decisions from governors and mayors around the country very much weighing on this administration, really putting them in the spotlight as not moving as quickly. The president's hand forced here by the collective decision that you're seeing in various jurisdictions around the country to declare this national emergency, which will then allow the Federal Emergency Management Agency, the acronym FEMA, often an acronym associated with disasters like hurricanes, tornadoes, and earthquakes. The Federal Emergency Management Agency will then be administering an emergency disaster relief fund of some $40 billion, given the declaration of a state of emergency. And this will then be distributed to various states for excesses in spending in terms of testing, in terms of the medical response, emergency response required at that level, and security. Remember, we are now in some unknown territory. What are the ramifications from a security perspective going to be in terms of people not being able to access their daily routines, people staying home, the financial burden associated with that? So we're going to see action and more detail from the White House later today, Francis.
And finally, very quickly, Sherwin, he did put forward the travel bans. Has that been supported generally?
Well, no. The World Health Organization advisory is that once this virus is prevalent or present in your country, closing your borders will have little effect. The virus, we have seen community transmission of this virus in the United States, so shutting a border really isn't going to reduce numbers, as you will. Although the president will tout this as being sort of a brainwave of excellence, the advice you're getting from the UN's health agency, the Global Health Agency, is saying that the blocking the transfer of people, the travel of people and goods, is not going to bring down the spread of the coronavirus, Francis.
All right. Thank you very much. Live from New York, Sherwin Bryce-Pease, our U.S. correspondent there.